If Tony had told me and I want to thank Dean Yekovich and Professor Brandt for having me. And if Tony had told me that I was going to follow one of the finest cello pedagogues in the world and finest cellist in the world, I'd have said, no, put me in some other time. But there's nobody I can follow that this may be the low point of all your experience. But I'm going to talk to you for a minute about performing arts medicine. And this is an easy talk to take. You can put your mind in neutral and just take this one as it comes. I represent the Texas Voice Center, and we're a collage of professionals, both singing professionals, speaking voice professionals, and medical professionals that commingle to help the human voice. And that's my charge, is to try to keep people healthy. It's a little tough sometimes with plaintiff attorneys, but with everybody else, we try to keep their voice up to snuff. Norman mentioned the fact that there's a lot of athleticism in music, and that's certainly true. And Bryn Terfel is an incredible baritone, and he's also a fabulous golfer. I'm really not a golfer, but I'm a good caddy. And so I follow him around, but Bryn can hit the ball 350 yards. It doesn't always go straight, but he can hit it a long way. And the other opera performers that are great athletes are Kathleen Battle is a great golfer, and Kiri Takanoa is a great golfer. So if you want to get Kathleen Battle to come and show up for sure, you have a good golf course that she can play. And it's fun to take care of performing artists because you get to have tickets to great events. And it's also fun to be the airway doctor for the Houston Texans and be there on the sidelines with all these unattractive ladies to help in case there's an airway problem with the Texans. Chichidia is kind of my third daughter. I majored in French at Yale, and Chichidia came here not being able to speak English. She could speak French because her dad was French, and Italian because obviously her mom's Italian. But we helped bring Chichidia into the American genre of singing. Well, we have a ranch in North Texas, and the first time she took a shotgun and shot a clay pigeon, she broke it. So another amazing, and her background was flamenco dancing before she went into opera. That should be, there we go. Nice thing about being a Houston Grand Opera doctor is these folks frequently stay with us, and when they do, you get a private concert at home. And the Methodist Hospital has started a center for performing arts medicine. And we're across the street, and we try to we've got about 150 doctors involved, and we try to provide specialty care to performing artists. And that's true with the Houston Symphony, the Houston Ballet, and the Houston Grand Opera. So whether it's Margot Fontaine's ankle or Yitzhak Perlman's carpal tunnel, I'm just saying, for example, he doesn't have a carpal tunnel problem, but or Domingo's vocal folds, we can do one-stop shopping, and the physicians that we've picked to take care of them in various areas of the body have a great expertise in that area, plus they understand performing artists. And being with the ballet and the opera and the symphony is a lot of fun as well. Chichidia decided she wanted to be a practice ENT, and her manager didn't think that was too neat. We focus on three things with the Center for Performing Arts Medicine, and that is patient education, and that's kind of what we're doing here to a certain extent, is just sharing knowledge so we can all cross-fertilize, and doing research projects, and I'll talk about that a little later, and then patient access. And I'm trying to get some philanthropists to give me about $40 million so we can put it in an escrow account, and then all the young wannabe performing artists, we've got them covered for medicine with at least a Medicare-type policy. And so anybody knows anybody with about $40 million, let me know, and then we'll cover Rice and University of Houston, Houston Baptist, St. Thomas, and the High School for Performing and Visual Arts, and we'll make sure that performing artists are well treated. And it's fun to take care of different performing artists. This guy is the Jerry Lee Lewis of the classical world. I mean, if you've ever seen Lang Lang perform, he probably burns 50,000 calories during a performance. And that gets us to the fact that these are athletic events. And I'll talk about that a little later. We've got to think about nutrition when you think about performing artists. Janet Horvath's a cellist with the Minneapolis Symphony and a good friend of mine, and she's written this book that's a good book, and particularly because she quotes me in it about playing less hurt. But it's a fabulous book. You can get it from Amazon. It's relatively cheap, and it talks about all the different problems of primarily string musicians. Hearing loss is something that we're going to talk about just for a couple minutes to make you aware. The senses are what we're involved with. The hearing sense, the visual sense, the taste, voice, all those senses to help us communicate and help us understand great music and understand other people. A little bit about anatomy of the ear. Basically, the ear converts sound from air pressure or sound pressure to mechanical pressure through the eardrum. Then it goes through a lever mechanism through the little bones in the inner ear, in the middle ear, and then into the inner ear is water pressure. It moves this cycle of water in the lymph system, in the endolymph system. And then it's converted to electrical energy through the hearing nerve. So there are a lot of conversions that happen to get sound into the inner ear. Hearing loss, trust me, you're all going to lose hearing as you get older. You want to do that. What you don't want to do is be exposed to noise so you lose hearing a little sooner than you should. And so we try to talk to folks about things that can cause hearing loss, premature hearing loss, and particularly noise exposure. And the iPod generation, I mean, Norman and I are ads for the Apple, because I got an iPhone here with my time on it, and got Apple, so you're going to think I got an iPad. I've got so much Apple stuff that you're going to think I'm a walking ad for them. But it's good stuff, except the iPod can give you a significant noise exposure. And if you've got the regular little Apple earphones, little earbuds, and you're in the front seat and you hear your child in the back seat, you hear that music, then it's a little too loud, so get them to turn it down. Tinnitus is, in the English say tinnitus, so they can be much more sophisticated than we are. It's an abnormal perception of sound. And it's like people that have lost a limb, lost their leg, and yet their toes hurt. Well, the toes aren't there, but the nerve stumps are, and the nerve stumps tell the brain that I have this abnormal feeling of the toes. And the same thing with the ear. If you get a significant hearing loss, then it can cause tinnitus. And Michael Hammond, the dean prior to Dean Yakovich, had a total hearing loss in one ear because he was going to a concert in New York, got out of his taxi. Some kids drove by, threw a cherry bomb out, and went off right next to his ear. And he had almost a total hearing loss in one ear for the last 25 years of his life. Noise is sound which is annoying. And to me, Schoenberg is annoying. I may be unique in that, but I'm more a harmonic fan. And so it depends obviously on the ear of the beholder. And noise is a note frequency conversion table. C4 to a singer is middle C on a piano, and that's roughly 263 cycles a second. A can vary from, that they used to tune orchestras, can vary from, in Handel's time, I think it was 418, and then it's crawled up now and goes to maybe 444, 446. Now, that's okay if you're tightening a G string. That's not okay if you're using a voice, because you've got to continue to increase the frequency with which you sing. And some sopranos all of a sudden became mezzos. Musical dynamics and decibel chart. Noise exposure. We've done the hearing test on probably 10 famous conductors. and they have very significant hearing loss. And it's a noise exposure pattern that drops at 4,000 to 6,000 cycles and comes back up at 8. Old people lose with a ski slope. It goes right straight down. And the very high frequencies are the most loss in presbylaryngis, which is presbyacusis, which is old people's hearing loss. We always wonder about noise exposure in symphony orchestras. They've done some work in Seattle with the Seattle Symphony, because they do the ring every year, and everybody figures, well, if you do the ring every year, then you're going to expose these musicians to Wagner for 4, 6, 8 hours. And it really doesn't seem that hearing loss is very common in most symphony musicians, unless you're the conductor or unless you play the violin. And interestingly, a violin puts out about 100 to 110 dB in our terms for measuring noise exposure. And OSHA, the Occupational Safety and Health Administration, would let you be exposed to that for about 19 minutes a day. I'm not sure if I know of any violinists that practice 19 minutes a day, but I think Norman's idea is a good idea. Maybe they need to spend a little more time thinking about it and a little less time practicing with their instrument. Bands can be horrendously noisy, and so band practice is a problem unless you're outside. And there are all sorts of organizations that deal with hearing loss, and there are tables for noise exposure level and how long you can be exposed to certain noises. There are musicians' earplugs, and the problem with hearing and symphony musicians is that they can't just put a foam rubber plug in their ears, because if they're supposed to come in when the harp or the flute hit a very high note, they may miss that and not know when to come in. So these musicians' plugs, which are pretty expensive, basically drop the noise exposure level by 10 dB. Now, when you're talking about 110 dB and you drop it to 100, you think, well, that's not much. But each dB is actually a log change. So that's a tremendous difference in noise exposure. And there are groups that take care of performing artists and watch out for their hearing loss, and there are a lot of references. And if anybody picks up one of those yellow sheets out there and wants to call us in the office, we can share any of this with you. Dr. Wiggins, who's a doctor of audiology, is going to come at 4:30 today, and she'll be in room 141, and we'll hearing screen anybody that wants to be hearing screened. And then in the fall, we're going to, and Andrew Tritter, who's a young doctor from Baylor College of Medicine, will be here to help her. And in the fall, we're going to start checking the music students here 3 times a year and do a little hearing screen on them 3 times a year. Jaw joint problems, real common in violin and viola players, and they all have a little problem under here. I saw Josh Bell get on a airplane, and he had just the biggest callus here you've ever seen. And I bet you Nadia Solina Sonnenberg has a tremendous callus because she wiggles so much. Breathing problems, we're just going to go through a collage of different medical problems of performing artists. It's not a big deal for me if I had asthma or if I got a cold. If you play a wind instrument or you're a vocalist, then it is a big deal to have asthma or a cold. We find that these high-pressure instruments, like horns and oboes and trumpets, can give you cardiac abnormalities as well. And all these areas need more research so we can figure out if we should put some of these people on medication to prevent that. Lip lesions, cold sores, particularly if you have one and you share your mouthpiece with somebody else, it's a real problem. And frequently the lip gets a little bit injured when you're blowing a horn, and killing the herpes virus is not real easy. The intraocular pressure, we found that some people that play high pressure instruments like oboe and horn and trumpet can have changes of glaucoma, but they have perfectly normal pressure at rest of the eyeball. And what happens is that when they blow their instrument, when they play, the pressure goes way up, and then they can get visual field contractions too. So we want to do a study trying to see if maybe eye drops would be appropriate for some people that have pre-glaucoma. Children that start playing a trumpet pretty early can have a sort of mashed in front of the face, and it causes developmental problems. I'm kind of partial to brass musicians. I have no talent, but I used to play a tuba, and I played it very poorly. But I sort of glom on to the brass music side of the equation because I appreciate what those guys are going through. And the biomechanical factors of blowing a trumpet and intraoral pressures when you blow, and you see how they pop out their cheeks because some of these fascial planes have broken. Posture obviously makes a big difference when you're playing a trumpet, and Bob Wolf plays with the Houston Symphony, and he and I have done several studies together. Arnold Jacobs, that wrote the book in Chicago, was one of his teachers, and Arnold Jacobs is a tubist, the finest tubist in the world. And musculoskeletal problems, I mean, they're athletes. I mean, finger athlete, small muscle athletes maybe big muscle athletes too. And when you're playing a cello or when you're playing a horn and you're moving all over, then you can get shoulder problems, you can get neck problems, all sorts of things. And the oscillators for my population, because I'm primarily a voice doctor, I'm ENT, but I'm heavy on T and light on the E and the N. The vocal cords, the way I'm talking to you now, they're oscillating in my neck. And they oscillate, make a sound, and then it's refined by the resonance, the rest of the body. And I think that's probably true of a string when you play a cello. It oscillates, and then that fabulous instrument that's worth more than I am that Norman plays is the resonant factor. And for brass musicians, the embouchure is the oscillator, and the instrument is the resonator. So we did a little work with Bill Vermeulen, who's a professor here and principal horn for the Houston Symphony. Can you keep is the sound on?
Slide right up.
But in a minute, I'll show you vocal folds, and they're very similar to the lips. And people, Louis Armstrong, the Satchmo syndrome was a rupture of the muscle that goes around the lips. And it wasn't diagnosed, and he didn't play a horn for 2.5 years until it spontaneously healed. Now we know that problem exists. I designated a young facial plastic surgeon. I said, you're going to be the world authority in the embouchure, because there are really not any. And so he is. And he works with a physical medicine doctor, and go in there, and they could diagnose the rupture and then go in there and fix it. And then they're back playing a horn in 6 weeks, not 2.5 years. And that's the ruptured muscle around the lips, and a few stitches in it and sewed up, and they're just fine, good to go after that. I was concerned about these blowouts of the larynx, and you've seen people, well, you saw Dizzy, you see these people with blown out cheeks, and I had a young boy that was 14 and had a big, what they thought was a congenital cyst in his neck. Well, it wasn't. It was a laryngocele from starting at age 6 to play a trumpet. And it's pretty common, and it's very common in the high-pressure instrument people. The safe instruments, obviously, are saxophone, clarinet, trombone, tuba, baritone. The more dangerous instruments for prepubertal people are the horn, the trumpet, and the oboe. So we measured all these. We did pressure tests, and I cut holes in mouthpieces, and then we checked the pressure in the mouth. and at the inside the back of the throat and also at the mouthpiece. Now the pressures at the mouthpiece were all about the same. They were perfectly normal, but it's back in the back of the throat that it gets high. And this is Dave Waters, who passed away not too long ago, but a professor of trombone here at Rice, and Bill Vermeulen with one of his students, and a tuba player, and we stick the probe in the back of the nose, and you can see it there where it goes in the back of the nose. And that's Bob. And we check the pressure at the mouthpiece level, and they're all about the same at the mouthpiece, even for tubas and things like that. But we checked in the back of the throat. It's real high in horn and tuba, horn and trumpet and oboe, and tremendous pressures back there. And what happens in children, I think, that are below puberty is they blow out these fascial planes that haven't really developed yet. And so I wrote a paper and published it that kiddos should not blow high-pressure instruments until they finish puberty. And I became very unpopular with elementary band instructors. But this was what the conclusions of our paper. Now, there are all kinds of things, and there are all sorts of devices to measure human performance. And this is a buddy of mine, George Kondrasky, in Dallas, and he is a great guy for developing instruments to measure human performance. And there are all kinds of hand-eye instruments that they can use to measure human performance. And then I worked with Michael Webster here on the clarinet, and there's poor Mike with me sticking things in him, and we're looking at Michael's tongue positioning and at the base of his tongue. And then the trumpet, we've got these pressure transducers to measure how hard you push the trumpet against your lips. And sometimes it's just way too hard. And trying to teach kids not to do that is really important, I think, in development of the upper and lower jaw. Repetitive stress injuries. I think what Professor Fisher said is so important, because the more people practice in a virtual environment, the less likely they are to do one of these things. And repetitive motion injuries are from repetitive motions. So if you're playing a rock piece on the piano and you haven't quite got parts of it right yet, but you continually go through the whole thing over and over and over, then you can set yourself up for some little problems with your carpal tunnels and your fingers. So we have a great hand doctor that takes care of, he's an orthopedist, and he says, if you can walk in, I can take care of you. He said it's the ones that can't walk in, that the lower part of the body that he doesn't really take care of. And the anatomy and the function of the body. Music in the brain, Ron Tintner is a great neuroscientist, neurologist at Methodist Hospital. He's also a composer, and so he composes rock music and he plays guitar. Real character. We're doing research projects in several areas now for movement disorders. We're teaching Parkinson's patients how to do a tango. That helps them socialize and helps them with the rhythm in their movement disorders. And we're going to work with MS people and with some of the other movement disorders. Stroke rehabilitation, Todd Frazier runs the Center for Performing Arts Medicine. He is a Eastman Juilliard graduate, professor of composition. And Todd and Anthony are doing a great project on stroke rehabilitation using music therapy. And we think it's going to be tremendously successful. Rewiring the brain. If they lose certain pathways and you got all these telephone cables, you just switch it to another telephone cable, and music seems to be the key to doing that. Anxiety and stress in surgeons. We've got thermal imaging, look at their face. We can tell whether they're stressed. Music may play a role in diminishing stress. I know in my operating room, if you walk in there, you're going to hear opera 24/7. Some other operating rooms, you may hear hard rock and whatever makes surgeons less anxious is really appropriate, and I think there's some opportunity for scientific study in that regard. Nutrition, I talked about this earlier. We forget that musicians and vocalists are athletes, and if you don't eat 2 hours before you perform, the problem is that the body gets hypoglycemic, gets low sugar, and we try to get the opera singers now, rather than drinking water during a performance, we have them drinking Gatorade. And so we have Gatorade backstage, and they'll swig Gatorade during the performance to keep the body's sugar level up so they don't become hypoglycemic, and all sorts of hormones come out when that happens. Speaking of hormones, Keith Reeves is an OB-GYN doctor. He's done some great work. I have a lot of, oh, I thought that was kind of funny. All right, let's look at it one more time. You'd never catch a lady doing that. Menstrual cycles, we have a lot of problems with postman. I had 2 daughters, and I know all about PMS. And we even had a female dog, so I had it PMS times 4 in my house. And it's very uncomfortable, and it makes it tough to perform. And so what Keith has done is they found that you could use hormones in a safe way to, if you're not singing in June and you're not singing in December, you have your cycles in June and December, and they can do that safely rather than having one every month. And then you're performing at La Scala or the Met or Covent Garden, and all of a sudden you've got PMS so bad that your tummy tightens up. Voice quality, we've shown that estrogen can be very helpful to the voice. Research, we can all say this, and no matter what we do, if we've seen further, it's standing on the shoulders of giants. A friend of mine from facial plastic surgeon from Alabama said that was Bear Bryant that came up with that. And I said, no, I think it preceded Bear Bryant by just a little bit. But Manuel Garcia is the man on whose shoulders I stand. He was an opera singer, lived 100 years. He and his father brought Marriage of Figaro to New York in 1846, and he got hoarse shortly thereafter and was the first human to see his own vocal folds using dental mirrors on his Paris balcony. So we owe a great debt of gratitude to Manuel Garcia. And what Manuel said was that if you use your hands, your arms, your voice, you need to know the anatomy, how it's built, and the physiology of whatever organ that is. And he thought it was very important that we teach people anatomy and physiology. So now I'm going to talk a little bit about the voice because it's my favorite part of the body. It's not as loud as a trumpet. The tessitura doesn't equal the range of a piano. A violin can certainly beat it in the production of staccato notes, but nothing exceeds the voice's ability to express passion and soulfulness. And here's where the larynx is located. And you can feel it. You put your hand up there, you go sss, you don't feel anything. You go zzz, and you can feel the vibration. That's the oscillation of the larynx. And it's held in this hammock of muscles so that it's very susceptible to stress. The muscles that attach to the hyoid bone right here go up, they raise pitch, and the muscles that attach to the hyoid and go down lower pitch. There's one exception to that, but that's pretty much a good generalization. We teach medical students and residents all anatomy, and all these different little muscles have names, and we teach them, and they forget it in about a week. And we teach them about the vocal folds and how important they are and how important it is to keep them healthy. That's a cross-section through the larynx. And this is something that we tell all the singers, is that the green things are mucus-producing glands. And you'll notice that there are no mucus-producing glands on top of the vocal fold. So you need mucus. If you took your hands, you rub them together, they get warm. If you put hand lotion on, they wouldn't get as warm. The hand lotion of the vocal folds is mucus. So you gotta have mucus. And so people don't get upset when they see a little bump on the vocal folds in our office. We show them, we put it in perspective by showing how big the larynx really is, and that our pictures are grossly magnified. This is a famous baritone And the movement, by definition, that's the right side, that's the left side, that's the back, that's the front. And sound production, why do you hear, I've got 5 grandkids now, and you can hear them screaming a block away, and that's because of the frequency. When we're born, about 490 cycles a second, and as you get older, the frequency drops down to about 100 for adult males and about 200 for adult females. We have all sorts of technology. Many of the fellows actually tested themselves yesterday, and they learned about all this technology to look at the voice. The singing voice has variations in frequency and amplitude, so it looks abnormal on our testing machine, but that's perfectly normal. Now, we don't use the term vocal nodules because it makes singers pass out, but if you have big bumps, obviously it can affect the larynx too. Phonetogram is the lowest frequency a person can hit up to the highest frequency, and the amplitude in between, and it ought to look like a great big footprint. And when you do a phonetogram on somebody with significant problems with the larynx, and it's very truncated. Very tough. Jim Gould is a good friend of mine. He was a Metropolitan Opera doctor, and he said that there ought to be, we need as many as 8 Annies, because that role is so tough. It requires an 8-year-old girl to belt, and they're just not equipped to do that. So it's a killer role. And vocal problems, the yellow, you can take all those yellow, I don't want to take any of that stuff home, so all those yellow pamphlets out there, you're welcome to, and please take them and give them to your minister or your choir director. If your minister talks too long, don't give it to them. This is the advice we give singers, and this is kind of the advice you'd give anybody, and Norman would certainly give this advice. Don't overstress yourself. And vocal problems, good vocal hygiene practice, and good general hygiene practice. Opera News, produced by the Metropolitan Opera, and I get 3 copies of this every month, and what astonishes me is this is the back cover. And that's what they put on the back cover. That proves that everybody can be a little bit of a prostitute if the money's right. And here's a larynx, our new technology, and you can actually read the United States of America around Abe Lincoln's head. And I gave a talk at Carnegie Hall last year about voice care, and New York Times was there, and I was quoted in the New York Times, but the quote was that by using this technology, you can tell whether a gnat is circumcised or not. So that hits the New York Times. Normal larynx together where they're oscillating, and apart where they're breathing down into the lungs. Dry larynx. And this is a young Rice graduate who, you see the sticky mucus that binds the vocal folds together. And you show that to a singer, they'll start drinking plenty of fluid right after that. So it's a good instructional thing. Edema, we can't say simple words because we learned that makes us sound like everybody else, so we have to use terms like attorneys do. So we call it edema. It's really swelling, and that's nodules in an 8-year-old boy. That's very common in little screaming kids, and if they're boys, you don't have to worry about it. They don't need speech therapy or anything. They'll grow out of it, and they'll be just fine.
Yeah, make that an eval.
This is a female, and it's a little more problematic in female. You see how the hourglass deformity of the larynx is there.
Again,
and
very gently.
It's not an efficient way to use sound. She won't be able to sing as long as she could without that. And that's a pseudocyst, a different. Here's a missionary from Honduras, and had a little hickey on his vocal folds. And ordinarily we treat them very conservatively, but this guy had to go back to Honduras, so we took him to the operating room. This is the only reason we've stopped the opera, and in 28 years being the opera doctor, it's happened twice. So it's very uncommon to have a bleed of the vocal folds, but you want to be very careful of patients when that happens, and that's one reason I've got all this equipment down at Wortham, and we stop the opera if we make that diagnosis. This is not Louis Armstrong, but it's very similar to what Louis's vocal folds looked like because his doctor was a friend of mine, and there would be a special place in Hades for the doctor that tried to make Louis Armstrong sound like everybody else. So if it's benign and we knew that was benign, then you just leave it alone because he is the voice is so wonderfully typical. I've had several countertenor wannabes, and interestingly, the countertenors are trying to decide whether to be a baritone or a countertenor. And I've got several of these singing baritone arias and then turning right around and singing countertenor arias. But guys can do something called falsetto voice, which is you shut off the back half of the larynx and you sing with the front half. Females can't do that, and it helps you get a real high sound.
A higher pitch, E.
This
Not that high.
21-year-old
Comfortable pitch, E.
gentleman had vocal folds that didn't quite come together,
real
and
E.
I had a question yesterday from somebody talking about a vergitur, and so I was going to show you a little
A.
2-minute addendum to the end here on what we do for vergiturs. Reflux disease, in the old days we told them you reflux when you lie down, you eat a big meal, and that's when you reflux. It's not true. And it's, I go over that in great detail in that yellow sheet out there. There's a big difference, and you see there the difference in the larynx. Erythema just means redness, but we don't want to use the term red. So pretty normal and pretty red there. Supraglottic edema, swelling again, and pretty good, a little more swollen, and pretty swollen. And lifestyle, anything, you just take care of yourself. And they said people that use drugs like spraying, in the old days, they sprayed cocaine on the vocal folds. And then it would numb it so Caruso could sing full out even though it hurt. And pain is an important thing. If it hurts, there's something wrong probably, and you ought to have it checked before and after treatment. And fat injections, what I was going to talk about, this is a way to treat a vergitur, incompetent larynx, puberiphonia, that little boy that was, well, he was 21 and his vocal folds didn't come together. So we suck fat out of the leg, and I'll show you how to do that so you'll all know how to do that. And the fellas went through the Mighty Lab yesterday and they learned how to do surgery. So these guys are going to be all ready to go. And here we'll show you just a quick surgical technique. Sort of pioneered that in Houston, and I've done about 400 now, so I'm getting it down. I've about got this. And we suck fat, kind of like you suck fat out of the tummy for cosmetic purposes, but I only need a teaspoonful. So, and then a nurse told me about this. That's a urine strainer, and that people use it to find kidney stones. And I use it to wash the fat. It works just great for us. We put it in the urine strainer, and then we wash it with a normal saltwater solution and flush out all the lipids. And then when you look at the wash water, you see it's got these lipids floating on top. That's ruptured fat cells. And that's prepared fat. And then I invented this thing, but don't get a nickel. They've sold thousands worldwide, but I don't get a nickel from it. So I was dumb. I should have had an agent or something that did that for me. But we put fat in a little syringe, and then we inject it, and you'll see me injecting it in the larynx. And there's a vergitur right there, that little trough, and you can kind of pop that out. And we always over-inject with fat, and about 70% of that fat will go away, but hopefully enough will stay so that the vocal folds become better friends. And this is before we put fat in. This was an English author.
When the sunlight strikes raindrops in the air, they act like a prism and form a rainbow. The rainbow is a
strikes raindrops in the air, they act like a prism and form a rainbow. The
That's
rainbow is a division of
22-year-old
white
Rice
light into many
computer
beautiful
science
colors.
student.
These take the shape of a long round.
And this is before in a 35-year-old male that had a real high-pitched voice, and you see the gap there. The vocal folds need to be good friends. They need to kiss and hold hands. They can't just wave at each other. So we try to put in fat, which is very compliant. You can't be allergic to it because it came from you, and it's cheap. And many people are delighted to share their fat in another part of the body. And it scares you when you look a week afterward, and that's why doing 400 of these, I'm not quite as scared as I used to be. And then there they are when it closes just fine, and that's that young boy. That's what the vocal folds look like. Turn the. This is the best part of the talk. This is Chichi on the inside. And somebody said, "How do you get an opera singer to do that?" And once they start looking at their instrument, they won't quit doing that. So it's hard to get them to stop. You see the different positions of the larynx when the high frequencies versus low frequencies. Well, I want to thank you folks for putting up with me. Questions? Okay. Anybody has a question? She said, yes, ma'am. I think you certainly want to stay hydrated, because the first thing the body shuts off, and it's in that yellow pamphlet, is mucus. And we have a real problem with famous singers that get on the plane in Milano, get off here, and are dehydrated by the airplane.
So I guess my question is, do you, because I'm always trying to tell my kids to drink water, and I heard this, and so then I'm telling them to drink Gatorade and water. Is that correct?
I think drinking plenty of water, and the index, if your kidneys are normal and you haven't taken B vitamins, urine ought to be about as you want to pee pale.
Right.
And so we tell people that. I tell ladies that when you leave the toilet, if you haven't taken B vitamins, you want it just about as clear as it was when you came. And guys, it's a little easier for them to monitor. But I want to do a study and look at the weight loss from Milano to Houston in the airplane, and I volunteered to go to Milano measure, and then Andrew's going to go out to Intercontinental and some way over here, so we'll have it on both sides. And whatever weight they've lost in that flight is water loss. It's insensible loss. And so we tell them about 12 ounces per hour they want to drink, and so they want to sit fairly close to the bathroom. But when you're performing, I think the Gatorade makes sense. I don't think that anything other than sugar is probably not that important with the Gatorade, but the sugar is the perfect combination of short-acting and long-acting sugars, and that's why it's such a perfect thing. And Dan Bernadotte, who's actually talked on this stage about nutrition and performing artists, feels very strongly it's the perfect combo. Powerade's a little too much sugar. Gatorade's just perfect. Yeah, if it's been 2 hours since you ate, then and you're getting ready to play a Beethoven string quartet, then you maybe ought to chug a little Gatorade before that or during the performance.
Okay, and then the other question was about the menstrual cycle and taking the pill or some type of something like that. That will not hurt the vocal folds.
I'm sorry, I missed what you said, and I'll try to repeat it.
If you were on, instead of having, if you were taking some type of birth control pill,
Yeah.
That's
No,
not going to hurt.
doctors, we can screw you up more than anybody in the world. I mean, we can over-medicate you, we can treat you cold with antibiotics, which are worthless. We can give you antihistamines because you got a runny nose and that'll dry up mucus. We can give you Detrol because of bladder problems, which will dry you up like a prune, and you will not be able to sing. You may not wet your pants when you're on stage, but you won't be able to sing. And so I think think those kind of things, steroids are overused. We overtreat people, and when they have a cold, they come in, they demand that
I'm talking about like a birth control pill.
Yeah.
That's not gonna hurt them.
I think the birth control pills, I address them in that little handout and on our website, and the website's accessible there. And you want to go as low on progesterone as you can, because that's a virilizing hormone. So you have to have a little progesterone, but just want to go on the low side rather than the high side. Yes, ma'am?
Okay, I have a question about the hearing test. Because I'm a musician, I have a tendency to hear the tones and expect what's coming next. I just haven't done an allergist and they do like an octave, and I'm saying yes, I can hear it where it is because like I think I already can hear it, you know, because I'm ear trained. So like, are there more advanced tests that I could take?
Trust me, when you have a PhD in audiology testing, they're really used to that.
Okay.
And so that they understand how to compensate for that. Because a lot of people will have, people with tinnitus will hear their own ringing, and they'll push the button just because they hear this noise in themselves. Me?
I was wondering about the effects of your bronchitis on your vocal cords. I've had it for 6 months. I can't get rid of it. I've tried every medication, and my vocal cords are doing a little wobble. And I'm just wondering how to get rid of that.
A bad cough can be a problem with vocal folds, and we don't really like opera singers to bang the vocal folds together by this horrific coughing. And then you need to find out why you have bronchitis. Do you have laryngopharyngeal reflux disease, which is pretty common, and it's detailed on our website in there. And if you do, then address that, because that may be why you're not getting well quicker. We do know that 82% of people with adult onset asthma have significant reflux, and if you put them on anti-reflux medication, you can pretty much stop the Ventolin or Proventil or all those adverbs of disaster. You can stop all that stuff. I'm done. Thank you all very much.